Good afternoon and welcome back to another episode of Small Talk Arkansas. Today is Thursday.
Which means Therapy Thursday.
Therapy Thursday on the Small Talk Arkansas.
It is.
Yeah.
Absolutely. For sure.
Welcome back to our Coronacation Kitchen Table Studio. I'm your host, Jason Martin.
And I'm Tessa Wilmans. If you guys are liking what you're hearing with us, you know what you should do? You should go to that little subscribe button that we've got over at YouTube, and you should push it, and you should share us with your friends.
Subscribe to the channel.
Subscribe.
Like the video.
Like the video. Comment
on the video. And share it with your friends.
With your friends.
That's all you got to do.
That's it.
It's pretty simple.
I mean, we would really just take, a subscriber or a comment.
Yeah.
But, we would really love it if you did all four.
Give us some support, guys. It's real simple. Do those things for us. We'd appreciate it. On today's show, we've got special guest Dori Haddock. Dori Haddock is the regional director for Bradford Health Services in Little Rock, Arkansas, where she's been since December 2014. She started at the Intensive Outpatient Program in Little Rock and has been instrumental in the development and growth of the program, which now includes partial hospitalization, day treatment, and outpatient services. Prior to joining Bradford Health Services, she has been a therapist, clinical director, as well as an administrator. Dori's originally from Albuquerque, New Mexico. She graduated with a bachelor in social work from the University of Mississippi. She went on to the University of Tennessee and graduated with a master of social work in 2000. Over the last 18 years as a licensed clinical social worker and as a therapist, she's worked with all populations ranging from young children to adults. She eventually found her love in treating substance abuse patients. She serves on the board of directors for the Eating Disorder Coalition of Arkansas, the Wolfe Street Foundation, as well as the Arkansas Coalition Against Sexual Assault. In November 2019, Dori was appointed to the Arkansas Alcohol and Drug Abuse Coordinating Council by Governor Asa Hutchison. On today's show, we have Dori Haddock.
Jason.
What's going on?
I think we've got a special guest in the house.
Yeah, today's Therapy Thursday.
It is Therapy Thursday.
We have another person that's going to help us with our mental problems.
We could use it.
We need
absolutely
lots of we don't have enough time in this show today, but Dori Haddock is on the show today. And Dori, are you with us? Can you fix our mental problems?
Well, if I can fix them, I can certainly try to help and get you in the right direction.
Well, you got 20 minutes. You got to fix us.
Wow. Put the pedal to the metal. We got to go.
That's right.
So
where do we start?
Crack those knuckles.
If you have to ask where do we start, you obviously aren't going to get this accomplished in 20 minutes.
Probably not.
So, you're a licensed social worker, clinical therapist. This coronacation thing is come on. It seems like it won't ever end.
Right.
It's kind of affecting everybody's mental well-being. Some more than others, and I think it obviously seems to exasperate. Whatever other things you had going on in your life, it just kind of magnifies them and makes them bigger. So, your specialty is in substance abuse, and have you noticed an increase in substance abuse during this time, during the coronacation?
Absolutely. We actually have had an increase of almost about 37% of admissions in the last month.
Wow.
Yeah, its alcohol sales are up by about 76%. Kind of nationwide.
Yeah,
it's pretty. It's kind of frustrating. Not frustrating, but in the substance abuse world, this doesn't slow down because of COVID, and it doesn't get better just because a pandemic. In fact, what you have is you have isolation, you have loneliness, you have fear and anxiety, which are pretty much the driving forces behind substance use.
Right.
So it's kind of the perfect storm.
Amplified.
Yes. So, we have seen an increase in relapse. We have seen an increase in admissions. We have seen an increase in people seeking treatment. And honestly, this is just the beginning. I think as a mental health provider, my specialty is in substance use, but I've been a clinician for 20-something years, aging myself now.
So you started really young.
I started at like 10. I was amazing.
You were
a
a clinical health prodigy.
I was. I mean, you can probably Google me and read about that. Actually, don't do that. As a mental health community, we're really just kind of gearing up because this is just the beginning. And I think we're going to see an influx once everything kind of opens back up, where this is not going to slow down for us.
Yeah, that's too bad. There's obviously, from a substance abuse standpoint, I mean, there's a lot of different, levels of substance abuse.
Right.
Can you kind of explain realistically what are different levels of substance abuse and how can we be aware of identifying those?
Sure. It's kind of difficult because it's one of the sneakier diseases out there, in that people that are suffering and meet the diagnostic criteria for a substance use disorder are very good at hiding and being, kind of, so it's a little bit difficult to notice, but there's different. So everything is diagnosed by the diagnostic manual. And so it's just kind of like our medical reference, and the diagnostic criteria for substance use disorder, they've actually changed that from abuse to use.
Okay.
Can range from mild to moderate to severe based off the symptoms that you're having. So, basically it's, are you taking it? And there's really not a difference between an alcoholic and an addict.
Right.
The way that it wires in the brain is the same. And so, we get ourselves caught up in, well, I'm an alcoholic, I'm not really into drug abuse. And we have to explain that that it's all hitting the same neurotransmitter pathways of the brain. And so it really has to be identified as one. And so they've categorized it as a substance use disorder. And there's actually about 13 different criteria that you have to meet. And based off of the amount of those criteria is whether it's considered mild, moderate, or severe. But the big thing is, there are people that go out and they drink, and they and maybe even dabble a little bit in some recreational drugs or over-the-counter drugs, but they're not addicted to them. And so the difference is it affecting your life? Is it affecting interpersonal relationships? Is it affecting your job? Is it affecting, are other people seeing that your use is a problem? And that's typically where it kind of starts taking us down that path where you try to stop and you can't, where you're taking larger periods over longer periods of time, or you're starting to mix it up a little bit. Maybe you were a beer drinker, now you're going to drink wine or hard liquor. So there's a lot of categories, but mainly the biggest thing we look at is, are you consistently having problems? Can you not stop when you're trying to? Does somebody else see it as a problem? And is it affecting your social, occupational, recreational behaviors because of your substance abuse?
Got it. And I mean, I guess that's, as you mentioned a minute ago, I mean, that's addiction. And I mean, we can be addicted to anything. You can be addicted to good things. You can be addicted to bad things. What is it that, I guess, from how people are wired, that they do become addicted to something that is harmful to them? I mean, what's the difference in, that versus being addicted to, I don't know, helping people, feeding puppies. What?
Man, sign me up for that one. I want to feed puppies. I think that's a really great point. Is really only about 10 to 12% of our population is officially addicted. And so where the difference is 50% of addiction is based off of genetic history. So if you have a family history of an alcoholic or an addict in your home, like your immediate family, then you already have a 50% chance of potentially having that. And then there's other factors. We use what we call ACEs, which is adverse childhood experiences. Those, that's going to be your childhood trauma. Mm-hmm. That's going to put you back up on the notch. There's also been some link to head injuries, which makes a lot of sense if you think about some of our professional athletes that are in really hard contact sports that are just chugging along just fine. And then all of a sudden it seems like the wheels come off the bus. Right. And so those are just some of them. So genetics, there's trauma, childhood trauma, grief and loss. Those things can kind of like set you up on that pendulum. So you may be already 50% genetically predisposed to getting it. And then you have childhood trauma, and then you end up having a head, and all those things kind of like create the perfect storm, and then the light switch kind of goes on. So I think that's what our patients really struggle with is, I was managing this for a small period of time, then all of a sudden, like, I just couldn't stop and it got worse. And so what we know is there's usually a triggering event that kind of like turns that light switch on and turns on that genetic that addiction. And so it's based off the dopamine levels and whether you have enough dopamine and when you get that surge. So just to give an example, when you have sex or you eat, our body gets rewarded with 200% higher levels of dopamine than our body naturally produces, which is your feel-good stuff. Mm-hmm. When you're an addict and alcoholic, when you get your drug of choice, it's 1,000% dopamine.
Holy moly.
And it stores in the part of your brain that we cannot communicate with. And so that's where I think a lot of people struggle is, okay, well, your life is falling apart. Why don't you just stop? I mean, what's the deal? Well, it's actually that memory is getting stored in your primal part of your brain. That function is to keep you alive. So if we have to eat and we have to procreate as a species to survive. So that's why we get that 200% surge, like, hey, do that again. And that's how we survive as a species. And so if you're getting rewarded for your drug of choice and I include alcohol in that, mm-hmm. then you're getting rewarded 1,000% to the part of your brain that's saying, do that again.
Wow.
So, and we're not set to function on 1,000% dopamine. So your body quits producing it naturally as a result. And then you'd have to have more. And that's where tolerance kicks in. And that's where, multi-drugs kick in. And it's,
and you just got to get a little bit more to get that same rush. Correct.
Mm-hmm. So it's pretty, I could talk for days about the science behind it because it's pretty interesting, but, and it's sad.
Yeah, it is. But it is fascinating what happens in the brain, honestly. Like, I didn't know that about the 1,000%. That's a lot.
Yeah. It's like, nobody ever dresses up on career day in kindergarten as an alcoholic or an addict, it's not something people strive to be. And so it's, and I know it's a very serious topic, but mm-hmm. we have to still be able to find some humor in the treatment and stuff, or we go, for lack of a better word, crazy. We're dealing with some sick patients, and it's mm-hmm. what I always kind of tell everybody is this is a disease. It's been classified as a disease. What we don't like is the symptoms of the disease,
right?
And when somebody gets cancer, they get another diagnosis. The community wraps their arms around them and comes in and brings meals, and nobody really questions the treatment plan. They just do it. Versus substance abuse, you try to wrap your arm around somebody that's refusing that they have a problem, and you just get met with anger and lying in defeat.
Yeah, it's a very, very different thing to, I can only imagine, as you take this on, this is where your heart is and your mission in life from a professional to do, this substance abuse and, the uses, to deal with folks that constantly, it's one of those things. If you get cancer and you go through the treatments and you get better, sure, it's possible that it could come back. It's possible that it could come back in another part of your body. Now, take something else where, you have an appendix problem and your appendix are removed. Well, that's not coming back. It's gone. It's over. You made it. You're on the other side. But with this, with what you guys deal with, not only can it reoccur, but it also, you're fighting constantly with people that are saying, hey, I don't have a problem and leave me alone.
Right. And the reality is, relapse is part of this. And so it's giving them the tools to live their life on life's terms without the use of substances. And that's really what we're trying to do. And, it's interesting for us. I think we're taking a little bit of a different perspective on the corona because more people are dying of opioid overdoses and alcohol deaths than have killed people from the coronavirus. Sure. And so, mm-hmm. We see everything shutting down and it's like, but wait a second, we still have this other huge pandemic that's been going on. And it's not fair to make comparisons of the two, but because people will say, well, it's a decision. And people don't make conscious decisions to ruin their life. By the time somebody gets to us and is looking for treatment, things have really hit a hard part of their life. Nobody's running in our office just super excited about treatment usually.
Yeah.
So
something's happened.
Yeah. If you're a friend or a family member of someone that you think they may be becoming dependent, they may be becoming addicted to something. First and foremost, what signs should we look for? I think probably most of those are kind of obvious and we've heard them over and over and over, but, realistically, what are some of the signs that we should look for that we should really, focus in on and go, yeah, that's probably where that person's going and what can we do about it?
Sure. I think, and to be honest, the drugs are changing so much. Sometimes the signs and symptoms are varyingly different, especially with marijuana and the high levels of THC that they've got in them right now. But mainly you're going to see a change in behavior. You're going to see more irritability, mood swings. Again, it kind of depends on the drug that you're using. If it's a amphetamine or a stimulant type medication, you're going to see people up for hours and not sleeping for days and then getting super cranky and irritable. You may even see some psychotic behavior. A lot of times when people get to the point where they're abusing drugs and alcohol, they're doing it alone. They're not going out to the bars and partying at this point. Now it's isolating. So if you see them just kind of isolating, withdrawing, change in behavior, irritability, crankiness, fatigue, and forgetfulness is a big one. And also just not showing up. If they just, a lot of times that's what we see is family obligations or work obligations get kind of put to the back burner. And so you'll see missing work. You'll see not showing up for family functions. You'll see, it's one of the biggest things about recovery is being accountable and doing the right thing. And so that just goes to show that some of those symptoms are not being accountable, lying, manipulating, those things.
So if we do notice those things, in friends or family members, I mean, how is there, cause that's a tough thing to approach someone with. So what is the best way to approach someone with trying to get them some help, or at least asking the questions if they are okay, if they need some help? How do you go about, what's the best way to do that without making that person go further that direction?
Coming from a place of compassion and care. I think, making what I tell patients, families all the time is be persistent, continue to offer care, continue to offer love and support, but don't continue to support the habit. So setting, once you identify that it's there and if the patient is not willing to do anything, then setting those boundaries of when you decide to get treatment, I will be here to support you. I will be here to help you, but I'm not going to continue to watch you, kill yourself. Mm-hmm. And so I think persistence is the big one. The patient's most likely going to tell you that they're not doing anything. And so just continue to point out facts and don't make it about feelings. Well, I've noticed that you're doing, you're not been going to work, and I've noticed, so something's going on. What can we do to help you? And so I think that's the main thing is don't just take the answer at face value. If you really know, continue to be persistent, because they're going to get to that point where they're done using and they're like, I've hit my bottom. I don't want to use the word bottom, but it's like I've hit to the point where I'm tired of being tired, and they're going to remember who is that person that continued to reach out and offer support. Got it.
So you mentioned the different levels, the mild, moderate, severe, for what types of treatments are out there, and what does Bradford Health offer to folks that are going through this that might be, family members, sometimes this may be, and I don't know what, you probably have a percentage for it, but, if this were to come up in my family right now, I'd have no idea. I would be completely lost. How do I go get this person treatment, or where do I go, and what options are available to them? So from somebody that's, mild, moderate, and then the severe, what types of services and help do you guys offer, and what do those programs kind of look like?
So at Bradford, we're actually been in business for over 40 years treating substance use. And so the different levels of care that we offer is your traditional residential. So residential treatment is where you go to a facility and you stay anywhere from 21 to 90 days, and you are there 24/7. You're getting treatment. You're working on getting the tools and getting stabilized before coming out. The next level of care is a partial hospitalization. Partial hospitalization is usually about 6 hours a day. So you come for the day for treatment, and it's multidisciplinary team that works with you. Like we do yoga, dietitian, and nutrition and exercise, and we even utilize essential oils and meditation. And then you go home at the end of the day. The next level down, intensive outpatient, and that is 3 hours a day, 4 days a week of group therapy. And that is I call that as the bridge. So it's the bridge for somebody that maybe isn't quite ready for residential treatment, but not ready to just kind of do it on their own. And then there's also those that have been in residential that have to come back to living in the same environment. And how do they? So it's kind of that bridge approach is what I look at IOP as. And then there's traditional outpatient, which is this individual therapy or one group a week. We are a big component of the 12 steps. And so we encourage our patients to get involved in 12-step meetings such as AA, NA, CA, those types of support systems. And of course, I think the statistic is like 86% of our patients have underlying trauma. Mm-hmm. So, got to address the underlying issue that's creating the need to escape and numb the negative feelings. So those are our levels of care. What we do is when somebody calls in for us, let's say it's a family member that doesn't know what to do, then they call us. We complete a free consultation either over the phone in person. And we get all that clinical information. It's presented to our clinical team, and we make a recommendation for the level of care so that the family doesn't have to guess. We can come at them with, okay, look, you meet all the criteria for a mild, so IOP might be a really good start for this patient. Or, wow, things are really, really difficult. Well, let's get him or her into residential and get that. So we help make that decision. Your doctors can help you find places. You can always call SAMHSA, which is an online tool for substance abuse and mental health. But if you call us and you're not a right fit for Bradford, then we're gonna get you somewhere that you are. And so we are in 5 states. We have 22 outpatient locations. We do have, if you call our number, you're going to end up getting a live person on the other end, whether they're here in Little Rock or in Alabama at our recovery advisory center to help get people tied into treatment. Because we know after 6 hours of that initial phone call, the follow through drops something like 45%.
Gotcha. It sounds like it's overall a holistic approach that you're taking. I mean, like you said, it's, if they've got trauma, you have to go to the root of what's really the problem and deal with that. Whether it's trauma or whether it's something else that's driven them to that addiction. Right. If you can't fix that, you're really probably never going to fix the addiction problem.
Well, and I think that is one of the cool things about Bradford, and it's not that it's the end all be all, but all of our clinicians are master's level therapists. So, I hear people say all the time, well, what's different about your program and this one? We utilize other support services such as peer recovery specialists or counselors in training, but the root of our group is being completed by a master's level clinician so that we can address those underlying issues in treatment and get them tied into those other supports into AA community that will help support their long-term recovery. So there's a difference between treatment and, AA or going to meetings and 12-step meetings. And although they work beautifully together, they're two different things.
Absolutely. Right. Well, we firmly believe we put this program together and to do Therapy Thursday. We believe in the mental health, and we believe in the, that it's, everything we do in life is kind of all one. And I like the fact that you guys talked about doing yoga and doing other types of meditation, physical activities, things like that are the same thing. You're replacing something that might be bad in someone's life with something that can be good and beneficial and redirect that energy.
Yeah, and we do a lot of that in mindfulness, and I think all of our staff is trained in motivational interviewing, which is a type of therapy style that's really effective with substance abuse. And I think everybody's favorite, and I'm not sure if I should even say this, is that we have a person in recovery that comes, I think they're 15 years sober now, and about once or twice a month, he brings his therapy dog in with him. That does, he brings this message of the 12-step, his recovery story, but he brings his dog that has over 100 commands, and it's just super cool. And so, of course, he has to have him because it is his therapy dog, so we're not breaking all the rules, but it's awesome. Everybody really looks forward to him coming in. And I think the big thing is that this job is awesome because people recover, people get well. We see people get well, and we have a lot of fun with it. I mean, getting sober doesn't have to be miserable. And so we have a lot of fun with our patients. And that's kind of what I think a lot of our patients don't understand. Like, how can you have fun when you're not using a substance, because it's surrounded their life so much that we try to make, yes, it's treatment. We're going to do the hard work. We're going to get in there, but we're also going to have some fun doing it.
Yeah. But life, it can be fun without, the garbage that you've been, using.
And most of them will tell you that it's a whole lot more fun once you get past get out of the trenches of it, and you start realizing, wow, I mean, they're much happier. And I joke all the time, if the world had a 12-step program, we would be in a much better place.
Well, that
whether
sounds
you
like,
have substances or not.
sounds like a good challenge for you, Dori.
Yeah, I'll take that. I'll add that to my to-do list.
Just put one together for us, would you?
Yeah.
Right.
So let's see. Bradford Health Services can be found. They're located at 11215 Hermitage Road, Suite 204. That's in West Little Rock. They can be found online at bradfordhealth.com. They're on Facebook and Instagram, both locally, Little Rock, Bradford Health, Little Rock, Bradford Health, Facebook and Instagram. We'll put links and contact information for all of that in the description of this video below. Dori, it sounds like you certainly are in the right profession to be, to really feel rewarded with what you guys do. And I think that's awesome.
Yeah, I think that's so cool seeing patients go from their worst to their best.
Yeah, it's great. That's why we do it.
Mm-hmm.
Well, thank you so much for being on with us today and sharing, and we look forward to hopefully we can follow up with you in the future. I know that without a doubt, this is, substance abuse is absolutely something that affects absolutely almost everybody out there. I mean, we run into somebody that's a friend or a family member. So hopefully we can continue this topic and bring an awareness to it.
Mm-hmm.
Absolutely. It touches everybody at some point.
Well, thank you so much for being on Therapy Thursday.
Thank you.
All right.
Talk to you later.
Have a great day.
Bye.
That was Dori Haddock with Bradford Health Services.
She had a lot of insight.
She does.
Yeah.
I mean, that's all the education and all of the years and years of dedication and service to it. So, I can see why, Governor Hutchison put her on the what was it, Alcohol and Drug Abuse Coordinating Council.
Yeah. Yeah.
So
she knows her stuff.
She knows her stuff. Definitely does. And it does make sense because often, I guess some of the things that I took away from that interview was the fact that oftentimes it is gloom and doom and doom when you're dealing with substance abuse. And, I know it can be aggravating to constantly deal with somebody that doesn't, they don't want to admit that they have a problem, all of those kind of things. And so, being able to have some professionals that they've done this, they do it every day, and they know how to do it
they know how to deal with those folks.
Yeah. With a whole different attitude and a whole different angle. To be able to really break through. So, if you have a loved one, a friend or a family member that is dealing with substance abuse, and you think they may be dealing with substance abuse, you can absolutely contact Bradford Health Services. They can help. Other than that, from an aspect of you may truly need some help getting through to your friends or loved ones that are going through this. And, you don't have to be aggravated and deal with this alone. There is help out there to get your friend or family member back on track.
Back at it. Yes,
Yep.
absolutely. Absolutely.
So is there something that you want to hear us talk about on Small Talk Arkansas? Is there a subject or a topic that you'd like us to bring to you? Would you like to be a guest on our show? Do you have a small business or a business that you'd like to promote a product or a service? We'd love to hear from you. Please contact us. Leave us leave us a comment. Contact us through Messenger. We'd love to hear from you, and we'd love we love nothing more than comments from our viewers.
We do, and we also love it when our viewers share with their friends and like our page and subscribe to our channel and all of that good stuff. Did I get the 4?
They do all the things.
They do all the things.
Subscribe, like, comment, share.
Yes. Thank you for that reminder.
That's.
I know. I'm like, where are all my fingers? I got to count them all. Anyway, thank you for shooting the shit with us, and stay safe, wash your hands, call your therapist.
Therapy Thursday. Stay safe, wash your hands,
call your therapist.
Yeah, you guys.
All the things.
I know there's a lot of stresses going on out there right now with coronavirus and people getting ready to go back out into the world and go to work.
Yep.
If you've got anxieties, things like that, definitely,
help. There's help.
Call somebody. We've got lots of people on the show that are willing to take your call and talk you through your anxieties and talk you through the issues that you might be going through. So, definitely mental health is really important.
It really is. And we think it's very important. And it's part of self-care.
It is.
It is.
Come back tomorrow for another episode of Small Talk Arkansas.
Bye.